Hi everyone, welcome. Tonight we're going to talk about triage. Now, if you're using the old training manual from 2011, it's in chapter 3 or unit 3. If you're using the brand new training materials, it's not in there. So we're going to talk about it tonight on this video. A couple of things to get us started that I need you to be aware of. Safety always comes first, always, no matter what we do. Hopefully, and during your CERT training, you've learned that. Safety always first. A couple of other things you need to think about is you need to stop, look, listen, and think. And probably the most important of those is think. Although all of them are important, you've got to think. Now, in thinking about triage, as you learned during your CERT course, PPE, your personal protective equipment, is always important, and it's that much more important when you're talking about medical triage. Your helmet, your safety vest, your gloves, your goggles, your boots, all of that is important. But also you're adding your medical gloves in on this because you don't know if you'll be exposed to blood or body fluids. So it's very important that you have all of those on. You can put those on and then wear them up under your work gloves if need be, okay? But if you're just dealing with patients or survivors, then you may not need your work gloves on, maybe just the medical gloves. But if you're having to move things, put your work gloves on top of your medical gloves. Now, a couple of things we want to talk about too as we're going into this. As you're approaching survivors, you need to be looking for safety. Stop, look, listen, and think. As you approach survivors, make sure they can see you if they're awake and conscious. As you get next to them, you need to make sure you identify yourself. Hi, my name is Carl, and I'm with the local CERT team. Identify who you are. Of course, you have your helmet and your vest and stuff on so they can see that, but they may not know what a CERT team is or what you're there for. So identify your name and who you're with and what you're there to do. Now, if you're going to assess them and you're going to have to touch them physically, go ahead and ask permission to touch them. Now, why do we do that? Because if you touch someone without their permission, what is that? That's assault and battery, okay? If you do something to them without their permission. Now, if they're unconscious and you're there to help them, it's implied consent that they would want you to help them because they've been in a disaster, they're injured some type, and it's implied consent that they would want you to help them. But if they're awake and alert, you need to ask them before you touch them. The next thing is HIPAA. Everyone understands about confidentiality. I, for one, want to keep my information private. All of your private information that you have, just like your health records, you want to keep them private. Only the people that need to know is who you want to know. So as you're taking care of people out in the field, if you have information about that person and their condition and what you did to them, you need to keep that private. You don't need to be telling other people, well, hey, I saw Joe down there and it looked like he had a broken ankle and I did this to Joe. You need to be careful. Do not be giving that information out. Now, a lot of times people ask, what if I use my phone and take a picture of the medical records so I can turn the stuff in and have those records on hand? Well, if you do that and you complete your written record and turn the stuff in and your CERT team has the record on hand to keep for future records, you need to make sure that stuff's deleted off your phone. It's up to you. You're the keeper of those records, and it's important that you delete those. Okay? You are responsible for it. If it comes up, you're the one that's going to be held responsible. Now, let's get into triage itself. The term we use is start triage, okay? And we're going to come back through in just a minute and really go through what all start triage means and do a demonstration of it, and we'll go through that scenario here in just a minute. But let's break down the word triage itself, okay? Triage is a French term that means to sort. So what we're doing is we're going through looking at our survivors and sorting them out based on their injury of who needs treatment first, who needs treatment second, who can wait a little bit, or who maybe can wait for several hours before they receive additional treatment at a hospital, a field station, an aid station, or somewhere down the road. Okay? So that's what triage means. Now, there are three things that we need to think about as we're doing our rapid triage and rapid treatment, okay? So when we're initially triaging someone, it should take somewhere between 15 and 30 seconds to do that initial assessment. Now, a lot of people want to say, well, I need, 10 or 15 minutes per patient. No, it should take somewhere between 15 and 30 seconds, okay? And everyone goes, oh, that's not fast enough. That's why you have to practice, okay? It's a learned skill. You can learn it, and you practice it, and you're able to do it. One important caveat I want to put in right now is when you're out doing this, try not to overthink. Try not to, oh, I've got to do this, I've got to do that. Let your training kick in, and then you will be able to do it. I can tell you from personal experience, when you're put in the situation, try not to overthink things. Just let your training kick in, and trust me, you will be able to do it. So the three things we need to look at are opening the airway, and we'll also say maintaining that airway, controlling bleeding, and treating for shock. So when we're opening the airway, we want to do the head tilt chin lift. Those of you that have taken basic CPR understand what head tilt chin lift is. You're just simply opening the airway. We'll talk more about that in just a minute. The second one is controlling bleeding. You have several different ways of doing that with bandages, direct pressure. We have pressure points. Remember, you always want to get that wound above the level of the heart to help slow down the bleeding. And then our last resort is tourniquets. Then the last one is treating for shock. And what is shock? Where you're not getting enough oxygen returned to the brain. And that could be for several reasons. One, not enough oxygen in the blood, not enough blood being circulated around to get that blood to the brain that has the oxygen. And so we've got to think about those three things as we're going through. So as we're doing our quick assessment and our quick treatment, rapid treatment, we've got to look at that, and we can do a real quick treatment. That's why they call it rapid treatment. And then we're moving on to the next person. So the triage team is doing triage. The treatment team is coming behind them doing treatment. So a lot of times the reason triage breaks down is the triage team stops and tries to treat everyone. You can't do that, okay? So you can do that quick thing to treat one of those three things, but then you're moving on to continue to triage the rest of your survivors that are in the field, okay? So let's talk about triage itself. In CERT, we like to use the ribbon method, okay? And it's one way, but there are several different ways or things that you can use. There are actual triage tags that are out there. There are several different ones that are out there on the market that can be used. Many of them have the perforated tabs that can be torn off, and whichever one is left on the survivor, that's the level that they've been triaged at. It's got plenty of places where you can write information, name, vital signs, things like that on it. But for CERT, we like to use the simple ribbon tags, okay? You can take this off, and they tear very easy. You can pull it off, and you can tie it around their wrist, around an ankle. You can also tear one of these off if you're in the triage team and put it in your pocket. That way you have an accurate count of how many reds you labeled, how many yellows you labeled, or whatever. Or a lot of times people will put a piece of tape on their thigh, and then they'll mark it. They'll put a R, a yellow, a green, or a B, and then they'll mark it that way with an ink pen. Either way is fine. If you have another way, a piece of paper. The thing is that you have a system that you're able to mark it. Now, what do these colors mean? That's what we need to explain to you. Let's start with red. Red, or the other term we use, is immediate. These are life-threatening injuries. These are the people that need immediate treatment as quick as possible. They need definitive medical care at a hospital, medical center, field triage area, whatever the case may be. These are the people that may pass away or die within the hour, next 2 hours, if they don't get definitive medical care, okay? The next one is yellow. Yellow or delayed. These are the people that have serious injuries but are probably not going to die from them. So these would be the next set of people that would need definitive medical care. So if they have to wait an hour to get to where they're going to that medical care, it's probably going to be okay. But we want to get them care as soon as possible. That don't mean we're going to wait till 5 o'clock tomorrow to get them to the hospital. They still need to go today, but if we wait an hour, everything will probably still be okay. The next one is green or minor. The other term we use for green is walking wounded. These are the people that have very minor injuries. And the reason we call them walking wounded is they're usually up walking around. These are the people that may present as something really bad is wrong with them, and once you assess them, you find out there's probably not much is wrong with them. They're just either scared, really worried, have a lot of anxiety, and is just really scared is usually what the problem is, okay? So a lot of times what you do is get these people involved in helping treat other people. They can do hold bandages in place if someone's bleeding. They can help move other victims if they need to, other survivors, to get them to where they need to be. So they can help you do things. They can go get other supplies. They can go get extra help if needed. Just wherever you can get them to do. Now, if they have trouble walking or something like that, of course, that's not the person you want to send to get other things. So keep it in mind, be smart, think about what you're doing, send them and put them in the right place, okay? And then the black tags, the black ribbon. These are the people that have died, okay? It's just plain and simple died. The other term that we use is expectant. Now, and this expectant doesn't mean that they're pregnant, okay? That's a whole other expectant. That's a whole other video, a whole other training, okay? So this expectant is that they're probably about to die. Their injuries are so severe, there's nothing we can do to save them with our level of training and the equipment that we have, okay? So it's one of those things that their injuries are so severe they are about to die. They may still be breathing at the current moment, but their injuries are so severe there's nothing we can do for them. So we would go ahead and tag them black. Say we arrive on a scene, and let's say we've been called to this disaster, and let's say a tornado has come through and there's been a school bus that got knocked off the road. And we have kids that are laying out the side of the road in a field, and we were told there's probably 15 to 20 kids out there in the field. It's been a lot of tornadoes that have come out that day, and there's a lot of damage all around the area. They've asked the CERT team to come out and help. Local emergency services have been overwhelmed, so we arrive on scene. We find the school bus is overturned, and again, the kids are out around the school bus, out in the field that's next to it. So what do? Well, we come up and we want to do our stop, look, listen, and think. Okay? We want to stop, look, listen, and think. Okay? Is it safe? Are there down power lines? Is there gasoline leaking? Is there a fire somewhere? Is it safe for our team to enter the field? Do we have all of our PPE on? Okay? Helmet, gloves, medical gloves, goggles, boots. Are we prepared to go in? If we are, then we can go. Now we start triage, which is simple triage and rapid treatment. A couple things you need to definitely remember. When you arrive on the scene, one of the other things that you need to take in consideration is, what am I going to do with 30 or 40 or 50 or 100 people? How are they going to hear me? Do you have a bullhorn? If you do, great, use it. If you don't, how are they going to hear you? How are you going to start separating out the survivors? Well, one way you can do it is go, hey, if you can hear me, come to the sound of my voice. Okay? As people start walking to you, what do you know about these people? They can hear, they can follow commands, and they can walk. Wow. They're probably greens or yellows, and there may be even a red in there that don't know they're a red yet. That's happened. I've seen it, okay? But mainly they're greens, yellows, and like I said, every once in a while there's a red in there that don't know they're a red yet, okay? So we get all those people over here and we can start triaging them. So whoever's left, hey, whoever's left, if you can hear me, raise an arm or a leg. So all of a sudden you'll see an arm or a leg go up. So what do we know about these people? They can hear, they can follow commands. But for some reason, they can't get up and move towards us. Okay? So we can send people out to start evaluating and assessing them. So that leaves everyone else. These people either didn't hear us, can't follow commands, and definitely can't move. Then we can assess them. Now, Carl, you just said if they're reds, we're supposed to get them first because they're the most severely injured. But yes, CERT also teaches doing the greatest good for the greatest number of people. And what did we just do? The greatest good for the greatest number of people. We quickly separated people out. We knew, it helped us quickly decide who the greens and some of the yellows, and again, maybe even a red, were really quick, and we were able to get them out of the way. Then we can also quickly put them to work to help us as needed. Then we quickly decided who was who, and that's even faster maybe that we can get the red some help. So it's one of the things that we need to think about, okay? Now, when we go and enter the scene, how are we going to make sure we don't miss someone? We can either go in and start triaging left to right. We can go right to left. We can go front to back. We can go back to front. Guys, it really doesn't matter. The thing is when you arrive as a team, someone decides, hey, we're going to go left to right. Everybody, whoever's doing the triage, you go left to right. That way you don't miss anyone. If everybody just runs out and starts doing and checking people and starts triaging, then it's possible that you would actually miss someone. It has to be done in a systematic way so you do not miss a survivor that possibly was a red that we needed to get immediate attention to, and we didn't because we just went out, ragtag, and missed them, okay? So we've got to be careful that we do that. So we go out and we start assessing. So what are we assessing for? So we go out and we find a survivor and we check them. Hey, are you okay? And they don't answer. You check for a pulse. They don't have a pulse. Okay? So what do we do next? Our first thing we're looking at is breathing, right? Okay, head tilt, chin lift. They do not start breathing on their own. Head tilt, chin lift again. They do not start breathing on their own. At that point, we label them a black. And we move to the next person. I know you're like, Carl, what do we do? Large-scale disaster. Remember, in CERT, we want to do the greatest good for the greatest number of people. Okay, that's our role. And if we stop and started doing CPR on everyone, and we've had large breakout of tornadoes in the area, emergency services has already been crippled. And if we start doing CPR, we're going to tie up all of our resources on one person when we have 15 to 30 out here that are injured. Are we going to be able to do CPR to get this person back low enough for additional help to get here to transport this person and to continue to do CPR where this person has a chance to survive? Probably not, no. Their chances of survival are almost zero, okay? So that's why head tilt, chin lift twice to give a chance in case it's their airway that's blocked. Because if it's their airway that's blocked, you'll hear them breathe. Okay, that's why you check it. I mean, you give them the benefit of the doubt and check it, okay? And if they start breathing on their own, then you finish the rest of your assessment. If they do not start breathing on their own, after at least 2 times, and then you can label them and move to the next person. This is the area that most people have the biggest problem with internally, and I understand that. I definitely understand that. But guys, we're talking large-scale disaster, and we're talking doing the greatest good for the greatest number of people, okay? So, we get to the next person, and we check them, and we check their breathing, and they're breathing 40 times a minute. I mean, it's almost like dog panting almost, okay? And you're counting. It's hard to count. They're just breathing so fast, okay? And you're like, so anything over 30 automatically puts them at a red, okay? Anything over 30 puts them at a red. Anything less than 30, we're going to continue to assess, okay? Normal respirations for a human adult is what? Anybody know? 12 to 20, that's correct. So anything over 30 in an injured person, we worry about. Anything less than 30, we're good for right now. We're glad they're breathing, okay? So we move on, and the next thing we do is do our Blanch test, okay? Or capillary refill is the other term. Now, I don't know if you've ever done this, but you look at the nail bed, and you squeeze it, and when you let go, you count how many seconds it takes for it to refill back up with blood. Okay, now if they have fingernail polish on, you flip it over, and you can do the other side, counts the same way. Okay, so you go 1001, 1002. Before I got to 2, it was turned back red again. Okay, so anything less than 2 is good. That tells me that my body is pumping out enough blood to fill back up the ends of my fingers quick enough. Okay, now if it takes more than 2 seconds, something's going on when enough blood's not getting pumped around in my body to fill up the ends of my fingers. Okay, so something's happened. Either I don't have enough blood, I'm bleeding somewhere, or my heart's not beating hard enough to get that blood pumped around. Again, anything over 2 seconds makes me an instant red. Okay? So a lot of people get that backwards in their head, so I want you to make sure you remember that. If it's less than 2 seconds, it's good. Over 2 seconds, it's bad. Automatic red. Okay? Let's say it's less than 2 seconds, we would move on to the next thing. We do mental checks. Okay? We want to check their mental status. We're going to ask them a couple of simple questions. Now, are you going to ask them their name? No, unless you know what their name is. So how are you going to know if they got it right? You know, you ask them, hey, what's your name? It's Bob. Well, their name is really Charles, and you don't know if they got it right or not. So you're going to have to ask them something you know the answer to, okay? Something like, what day is it? Or what year is it? What year is it's good enough? Now, be careful in January asking that question because they may say the last year, okay? Other things that you can ask would be something like, what town are we in? What state are we in? Maybe you're way out in the county. What county are we in? Those things that you can ask. Now, would you ask a 5-year-old child that? No. Those types of questions for a child are not the good ones to ask, okay? But things like what day is it for adults, what town are we in, what county, what state are we in, what year is it, is usually a pretty good question, except during January. If you're near a holiday, what holiday was it last week? You know, things like that. Stuff you know the answer to is okay to ask. If they can't answer those types of questions, then they're not getting enough oxygen to their brain or something's happening with their cognitive ability, so they would be a red, okay? Let's talk about bleeding. If they're losing a lot of blood, it's going to affect all of those areas, including their breathing. That may be why they're breathing heavy, is to get more oxygen in because the rest of the body's not getting oxygenated. So that bleeding is another big important thing that you need to think about. You got to think about those bandages, those pressure points, getting those limbs elevated, and don't forget about your tourniquet because it may be time to put it on. 3 types of bleeding are arterial, venous, and capillary. So with arterial bleeding, what color is that going to be? Yeah, it's going to be bright red blood, but we're going to triage them as a red because they're going to bleed out if we don't do something quick. Odds are, with pressure, you may end up using a tourniquet on them, but they're definitely going to be a red. What about venous bleeding? What color are they going to be? Yellow, maybe a green, depending on how quickly you can get it stopped, okay? And with it, direct pressure, elevation, probably not going to need a tourniquet with venous bleeding, okay? And what's the other? Capillary. That's where you fall off your bicycle and run across the pavement and you get up and you have all these little spots of blood. What do you need there? Just wipe it off. They'll be good, okay? Or like the kids do and wipe it on their shirt and they're good, okay? So it's important you think about, and how do you determine which is arterial bleeding? What does it look like? It looks bright red and it'll be spitting at you, okay? Every time that heart beats, toot, toot, toot. And it's one of those things with arterial bleeding is, I've never seen anyone walk up and go, I wonder if that's arterial bleeding. It's one of those things, you see it the first time, you're going to go, that's arterial bleed, we have to do something right now. Okay, it's not one of those. If it's venous bleeding, it's going to be dark red. Okay, trust me. It's one of those times, if you see it once, you'll know what it is. Okay, let your training kick in, get it stopped. Okay, so when we're looking at that and doing all that with our survivors, you're thinking about start triage as we're going through and doing this. Remember, Your safety comes first in doing all of this. Your safety never takes a back seat to everything that we're doing. If your gloves become bloody or they become contaminated, what are you supposed to do? Change them out, put a new set of gloves on before you move on to the next survivor, okay? One of the things that you need to take time in doing is practice putting medical gloves on and practice taking them off. It's one of the things that I want to make sure you do. Your CERT team should be able to get some extra gloves for you to practice at least a few times with, and to be able to practice that, because it does take practice. Make sure when you're taking them off, you're sliding that finger on the inside and putting it over the second one on the inside. That way you're only touching what was now the outside of your gloves were the inside of your gloves, okay? Trust me, you do it a couple of times, you'll never do it another way the rest of your life. You'll do it the same way. You can do it in your sleep. You'll do it the same way every time from now on. That concludes our stuff about triage. We're fixing to get ready to go out and do our exercise. Want to thank you. Remember, safety first.
All right, anybody that can hear my voice, please make your way this way.
To set our scene for our start triage exercise, they're in Mississippi, and there's been an outbreak of tornadoes today, and in a tri-county area, and there's been multiple tornadoes. This particular scene, a school bus was hit by a tornado, and there's somewhere between 15 and 20 kids are on the bus. Local emergency management has been well overwhelmed, and they've asked for local CERT teams to respond to help search and treat victims. That is this scenario. In CERT, we like to use the ribbon method. Green or minor. The other term we use for green is walking wounded. These are the people that have very minor injuries. Yellow or delayed. These are the people that have serious injuries but are probably not going to die from them. So these would be the next set of people that would need definitive medical care.
And we'll just have all you guys move this way, please.
As they approach the survivor, they shake him, he doesn't respond. Doesn't respond. Check his breathing. Is he breathing?
No, I don't see the chest moving.
He's not, chest is not breathing. She as you saw, she knelt down over him. She felt no air coming in and out of his mouth or his nose. Nothing. Looks at chest, not breathing. So she's going to do that head tilt, chin lift, trying to open up that airway. She did it once. Patient did not spontaneously start breathing on his own, so she'll do it a second time. Head tilt, chin lift. Patient did not spontaneously start breathing, so still labeling him a black. Move to the next survivor. They'll do the same thing with this one. Shake him and see if he moves. See if he answers.
You okay?
No answer. Check for breathing.
Is he breathing?
No breathing. So they've checked him. He's not breathing. As she's checking. No breathing. Head tilt, chin lift. See if spontaneous breathing returns. No spontaneous breathing. 15 seconds. Recheck. Head tilt, chin lift a second time. Recheck, see if spontaneous breathing returns. It does not at this point. Since his wrists are not available, they can put one around his ankle. They'll label him black, move to the next survivor. With this one, they're gonna shake.
Are you okay?
And he moans a little bit. I hear him moaning.
I hear him moaning.
Checking his
You
breathing.
Is he breathing?
Yes.
He is. She's counting his
breathing.
breaths. And his breaths are 40 times a minute. Checking his capillary refill. on one of his fingers. Grab one finger, squeeze it. Ooh, that took a little over 2 seconds then. It's closer to 3 seconds. So with breathing 40 times a minute and capillary refill greater than 2 seconds, that automatically puts him into a red. So we're worried about what with him? Shock.
Shock.
So how are we going to treat him for shock? What would we need to do?
Raise his legs.
Raise his legs up. 6 to 10 inches. So for right now, they're just going to use his bag. But you could use a pillow, a blanket, many other different things, whatever's available. We've done the rapid treatment. We're going to move on to the next survivor. All right. He's alert, and they're asking him what's going on. And he says,
I don't know. We got hit by that tornado and my arm is really hurting.
Okay, let's try to help you out.
all right, she's checking his breathing. He appears to be breathing about 26 to 28 times a minute.
Yeah, he's breathing. Pulse is good. Sort of.
Checks his capillary refill.
So, let me see this finger here.
And in his uninjured hand, it's less than 2 seconds, which is good. But he is confused some
Yes.
when she asked him questions. So, what color should he be? He does know what's going on. He knows they got hit by a tornado, and he knows he was in the
What
school
day of the
bus.
week is it?
So,
Wednesday.
What day?
Wednesday.
Wednesday.
Yellow.
so he's going to be a yellow. Now, of these, who would we get off the field first? The reds and the yellow.